Hi, welcome to Mind at Ease, where today we'll be discussing bipolar disorder or BD. The purpose of this channel is to educate the community, reduce suffering, and also reduce the stigma surrounding mental illnesses. Today we have Dr. Jacob Palathinkal, who will be explaining to us what bipolar disorder is, its causes, and treatments. According to the NIMH, or National Institute of Mental Health, bipolar disorder affects 5.7 million Americans over the age of 18. And it was also found that BD affects both men and women equally. Dr. Palathinkal, what is bipolar disorder and how does one differentiate it from the normal ups and downs?
No other mental health disorder is misdiagnosed as much as bipolar disorder. According to the National Institute of Mental Health, individuals obtaining the correct diagnosis of bipolarity or bipolar disorder may take up to 10 years. This is based on the fact that patients are poor informants. They may be presenting to the provider during a depressive phase, not being able to provide collateral information, and providers not inquiring about historical symptoms of mania or hypomania. There are three subtypes of bipolar disorder. There is bipolar 1, bipolar 2, and cyclothymic or cyclothymia disorder. Bipolar 1 is what we commonly known as manic depressive episode, where the individual experiences elated mood. They're so full of energy. Patients may experience delusions or paranoia or hallucinations. And the manic episode should last 7 days, and the depressive episode should last at least 2 weeks to qualify for a diagnosis of bipolar 1 disorder. On the other hand, bipolar 2, or known as hypomanic or depressive episode, it's a much lesser intensity of symptoms compared to the manic episode. The individual may experience low grade, what we call a low functioning of hypomanic symptoms. Individuals may present to the provider once again during depressive phase, so it's important to inquire about historical symptoms, how long it's been happening, what are the comorbid symptoms of hypomania. The third type, also known as cyclothymic or cyclothymia disorder, the median age of onset of bipolar disorder symptoms is approximately 25 years of age. Women tend to be misdiagnosed as having depression, while men tend to be misdiagnosed as having schizophrenia. Some of the other common disorders that can be misdiagnosed for patients presenting with bipolar disorder is ADHD, or also known as attention deficit hyperactivity disorder, because both disorders, patients may experience hyperactivity, poor impulse control, and some mood symptoms. So it's very important, once again, to inquire about historical symptoms, duration, if possible, obtaining collateral from family, and also the provider's comfort level or able to question about many other aspects of the patient's day-to-day living.
How does a patient present to you during a manic phase?
Patients who are presenting to my office in a manic episode usually present to my office with very much full of energy. They're speaking very fast. They have pressured speech. They have so many ideas where they run from one thought to another. Patients always talk about wanting to invest funds into multiple companies without doing any research work. Their family members, whether the husband, wife, or a significant other, might say that so-and-so is not sleeping or has not slept for the past 3-4 days. But this person in front of me appears with full level of energy and has the energy to go functioning for the next few days. These are some symptoms that are present during a manic episode, and they're also very much restless.
So as a provider, how do you differentiate schizophrenia from BD?
Now, bipolar disorder can be confused, but the cardinal symptom of bipolar disorder is elated mood or severe mood lability, from sadness to irritability, while individuals with schizophrenia experiences loss of touch with reality. They experience delusions, paranoia, hallucination, whether it's command auditory hallucination versus visual or auditory hallucinations. So the core symptom or the cardinal symptom is the individual with bipolar disorder may not lose touch with reality.
What are the causes of bipolar disorder?
Bipolar disorder, like many other psychiatric diagnoses, there is a high heritability factors. First degree relatives of people with bipolar 1 disorder are approximately 7 times more likely to develop bipolar 1 disorder compared to the general population. The offspring of a parent with bipolar disorder have a 50% of chance of having another major psychiatric disorder. Another study found that perinatal factors such as birth complications as a cause of developing bipolar disorder and other mood disorder.
What are some of the common treatments available in treating BD?
Bipolar disorder requires lifelong treatment. Choosing the right treatment or medication is based on the presenting symptoms. Patients may be prescribed mood stabilizers to stabilize their mood, antipsychotics if they're experiencing any type of psychosis, and antidepressants if they're also experiencing depressive symptoms. The most important thing to keep in mind is the patients who are struggling with bipolar disorder is to reduce relapse. So it's very important to provide psychoeducation about medication compliance, telling them not to prematurely stop the medication because they're feeling well at that moment. So psychoeducation is a big factor in preventing relapse, along with assessment by the provider and the importance of being in therapy is a very major factor in keeping bipolarity symptoms in control.
What are some of the diagnostic tools used by providers in confirming a BD diagnosis?
Before getting into utilizing the tools, it's important to have a good mental status examination. Assessing the patients as a provider, I feel, is the most important tool that I have. But there are many tools on the market that you could utilize to rate either the acuity of the symptoms or in aiding the diagnosis of bipolar disorder. The ones that I'm very familiar with is one is called MDQ, or Mood Disorder Questionnaire. Then there's one called YMRS, or Young Mania Rating Scale. These tools, once again, is to help in aiding screening for the diagnosis and the severity of symptoms. But the patient's presentation is the telltale sign of whether the patient is struggling with depression versus bipolar disorder.
Thank you for joining us today on Mind at Ease. If you have any questions, comments, or concerns, please feel free to leave them down below or you can email us. Thank you.